going to talk to you today about chest tubes. It's part of our skills fair. This is the chest drainage unit that we use here at the hospital. It is a closed system. When you get ready to set this up, you'll turn it over to the back. There will be a pre-filled 10 cc syringe with saline on the back. You will pull it off of the back of the syringe of the unit. There is a port on the back of the drainage system. You will empty the contents of the syringe into that port, which will fill this chamber up to the dotted line there. Okay? Your suction will attach to this port at the top of your unit. Okay? There are also handles in the handles that you can use to hang on the bed if needed. There's also a pedestal at the base of the unit that you can set it up on the floor. Your chest tube will attach to the end of this hose here by pulling this off, and then the chest tube will attach there. Okay? Now, when you hook this up to your suction, there will be a check mark that will come in this indicator window here that will show up there, which says, yes, I'm hooked to suction. Now, to know how much suction that you need to use, there is an accordion-like bellow that will expand out into this window here. It needs to come to this arrow. If it does not come to the arrow on the window, then you need to turn your suction up. If it goes past the arrow, then back down off of your suction so that it will come to the arrow. This window here, when you get it out of the box, it will automatically be set to -20 centimeters of water, which is the typical standard that Dr. Green and Dr. Rayo both use. But if for some reason they decide they want something different, there is a dial on the side that you can turn, which will change your pressure there. Okay? Your blood or your fluid from the lungs will collect in this chamber here. This is a disposable unit, not a reusable unit. So if your unit fills up, then you will need to change that. I'll go over that in a moment. Now, let's say that the doc gets the chest tube into the patient's chest wall. So I've got a chest tube here, and I'm going to hook up my connection there. And then I'm going to tape this very securely with some silk tape or maybe some foam tape to secure that and make sure that that is good and secure. We don't want this to come apart at all. You always need to keep a Kelly clamp and occlusive dressing supplies at your bedside, such as Xerofoam or Vaseline or adapted gauze, and some 4x4s and some of that foam tape, always at the bedside. Okay? So let's say that we've got this hooked up and all's working well, and the patient happens to turn over and this becomes disconnected. What are you going to do? You're going to grab your Kelly clamp, you're going to clamp it here, you're going to reconnect, retape your connection to secure it, unclamp your clamp, and you should be good to go. Let's say that the actual chest tube gets pulled out of the chest wall. When you see that, cover with a gloved hand the site and grab your occlusive dressing supplies at the bedside and cover with the dressing supplies and notify the doctor. Like I said, when this is full, you are going to change this and you're going to do it the exact same way. You will take your Kelly clamp and clamp your tube. You will also clamp this tubing here. You will disconnect. You will reconnect the new unit, retape it, and unclamp your sides. And then you should be good to go. There is also a port here to draw specimens out of if you need to send a specimen to the lab. There's also a way to disconnect your tubing here. Never do this. And I repeat, never disconnect your tubing, ever. Okay? And one last thing, if this unit happens to be turned over in the floor and it's laying down, you can set it back up, and if you'll turn it around, right under the handle is a small little button. You'll push that, and that will re-equalize the pressure back in the unit so that everything is stable. And that's it. Thank you. Have a good day.